Welcome to Sonu's Art on YouTube Academy Official. Today's topic is clinical type of myopia. Clinical classification. Simple or developmental myopia. Pathological or degenerative myopia. 1. Congenital myopia. 2. Simple or developmental myopia. 3. Pathological or degenerative myopia. 4. Acquired myopia, which may be post-traumatic, post-keratitis, drug-induced, pseudomyopia, space myopia, night myopia, consecutive myopia. Etiological classification. 1. Axial myopia. Commonest form, increase in anteroposterior length of the eyeball. 2. Curvatural myopia. Increased curvature of cornea, lens, or both. 3. Point positional myopia. Produced by anterior placement of crystalline lens in the eye. 4. Point index. Myopia. Increases in the refractive index of crystalline lens associated with nuclear sclerosis. 5. Myopia, due to excessive accommodation. Age-onset classification.
Role of the diet in early childhood. Role of genetic autosomal dominance, prevalence in children, both parents, myopia, 20%. One parent myopia, 10%.
Congenital myopia. Since birth, youth onset, below 20 years. Simple myopia. Myopia development, between early NS, late adult onset, 40 plus.
Developmental myopes, commonest variety. School myopia, school-going age, 8 to 13 years. Etiology, type of myopia. Axial type means physiological variation, length of eyeball.
Congenital myopia. Since at birth, diagnosed by 2 to 3 years, mostly unilateral, manifests as anisometropia, high degree of error. 8-10 diopter, child may develop convergent squint in order to preferentially see clear at its far point, 10 to 12 centimeter. Premature, Marian syndrome, homocystinuria, associated with cataract. Microphthalmos, aniridia, megalocornea, 1. Congenital separation of retina. Simple myopia. Developmental myopia, common variety. School myopia. School-going age, 8 to 12 years. Etiology. Axial type. Physiological variation in length of eyeball. Precocious neurological growth during childhood. Curvatural type. Underdeveloped of eyeball. Role of diet in early childhood. Role of genetics, autosomal dominant, prevalence in children. Both parents, myopia, 20%. One parent myopia, 10%. No parent myopia, 5%. Etiology. Axial type means physiological variation in length of eyeball, then precocious neurological growth during childhood. Curvatural type, underdeveloped of eyeball. Role of diet in early childhood. Role of genetic, autosomal dominant, prevalence in children. Both parents myopia, 20%. One parent myopia, 10%. No parent myopic, 5% chances to have high myopia. Symptoms.
Begins between 7 to 10 moors, about 5 diopter. Never exceeds 8 diopter. Poor vision for distance. Visual acuity beyond puncture. Remotum affected, half shutting of eyes. Stenopic vision. Orthanopic, it's with small degree of myopia stain symptoms development between dissociation between convergence and accommodation.
Signs. Prominent eyeballs, anterior chamber, deeper than normal, pupil, large, sluggish reacting, fundus, chalked, normal. Temporal myopic crescent may be seen. Magnitude of refractive error, increasing at rate, 0.5 plus 0.30 year. Does not exceed 6 to 8 diagnosis.
Pathological
Confirmed by
myopia,
performing
degenerative or
retinoscopy.
progressive myopia. Rapidly progressive error, which starts in childhood at 5-10 years of age. High myopia in early adult life with degenerative changes.
Etiology. Role of heredity. Heredity-linked growth of retina is the determinant in developmental myopia. Sclera, due to distensibility, follows retinal growth, but choroid undergoes degeneration due to stretching, which in turn causes degeneration of retina. Progressive myopia is familial, more common in Chinese, Japanese, Arabs, and Jews. Uncommon among Negroes, Nubians, Sudanese. Role of general growth process. Lengthening of the posterior segment of globe commences only during the period of active growth and ends with termination of active growth. Genetic factors play major role. General growth process minor. More growth of retina. Stretching of sclera increases axial length. Degenerative of choroid degeneration of retina, L degeneration of vitreous. Thanks for watching and don't forget to subscribe.